uh, um, joined the first consultancy that said yes to me and let me do nothing but healthcare, and that was Oliver Wyman. I thought I'd spend 1 or 2 years there, and then moved over to Singapore in 2014, 3.5 years in. So I spent almost 8 years at Oliver Wyman, which was a lot longer than I thought I'd be there. Moved to Singapore, saw a lot of entrepreneurs that were trying to solve some pretty big healthcare problems. And boy, were there a lot of healthcare problems in our part of the world. And not in Singapore per se, but in the 680 million people in their backyard. Started doing that, and then realized that was a whole lot more fulfilling than writing PowerPoint slides for a living. So decided that I needed to really do this full time. I did not have $10 million in my bank account to do this with yet. So I had to use other people's money. The most logical, insane thing to do at this point would be to join a VC fund. However, I could not find a VC fund that was investing in the kind of things I was looking for, which are really, super early, like first or second investor in a company. I don't even know what to call it anymore. Seed, pre-seed, soil, pollen. I don't know what to call it. But it's first, second capital in like really big healthcare problems that were relevant to emerging markets. And so having not been able to find that, I had to start a VC. So that was in 2018. And, 3.5 years later, here I am today. And that is Verge. We have invested in 14 companies across 12 countries and 5 continents. We've impacted over 2 million lives, which is good, but not even close to scratching the surface of what needs to be done. And we're going to start a second fund soon. That's it.
Thank you for the intro, long intro. We were waiting for panel speakers, so that was pretty long, but good to know all of your personal stories. Our second panel speaker is finally here, Vikram Kapoor, senior partner at Bain & Company and APAC Healthcare Practices Head. Personally, my former boss, I was a consultant at Bain & Company and APAC Healthcare Practice. Good to see your face again. Vikram, do you want to introduce yourself a little bit?
Absolutely, and it's all it's another reaffirmation that Apple seems to work better than anything else. Where I apologize, I was struggling on my work PC and I had to borrow my wife's Mac to jump on. But now I'm even more convinced why I need to upgrade to the real world. But pleasure to meet everyone. I'm Vikram Kapoor, a partner at Bain. I've been at Bain 20 years now. Never thought that this journey would be that long. Much like Joseph, I started actually I'm an engineer by training. An electrical and industrial engineer. I came into consulting 20 years ago at Bain in Chicago, thinking I'd be here for 2 years. I started as a generalist, and a couple of years in, got my first exposure to healthcare. And I think what inspired me about that was I liked the fact that there was just an industry that was so complex and so broken, and it really needed solutions that were pragmatic. What I found inspiring was just the broader mission orientation of this sector, and working with people who really were out there to make a difference, and you could see the impact of the work I was doing in the day to day, and so that allowed that inspired me to focus more on healthcare. I took a two-year break from Bain to go to another business school to study healthcare as part of the MBA program. Came to Bain, came back to Bain in New York, focused on healthcare. And then about a decade ago, my wife and I had the opportunity to come to Asia for a year on an adventure to see what it was like. We were just starting to build our business here. Everybody, of course, told me that, no one goes to Asia for a year. You should think about 3. Of course, I should have paid more attention to that. 1 became 3, became 5, became 7. It's been a decade now, based for many years out of Greater China and now based out of Singapore. Spend a lot of my time, working in healthcare across the region from India to Australia. And what's been really inspiring over this period of time as we've helped grow our business here is just the opportunity to work with very mission-driven, inspired individuals who are looking to transform the way care is delivered. And what inspired me most about what's happening in this region is, and again, I say this with all due respect, we can't afford to make some of the mistakes that were made in other parts of the world. We can't spend 20% of GDP on healthcare. Healthcare will grow and evolve very differently, and in this part of the world, and frankly, is an inspiration for other parts of the world. And when I moved here about a decade ago, everybody wanted to know what Kaiser Permanente was doing, and what was happening in health systems in the US. today we spend more time talking about what we can learn from HaloDoc, and Jonathan will be on in a few minutes to talk about the inspiring journey he's been on, and Ping An Good Doctor, and how care is really being transformed. And much like everybody else, the last sort of 2 years have been spent a lot at the intersection of healthcare and digital. I feel we're at the dawn of a golden age of healthcare, and it's just a pleasure and a privilege to be a part of one part of this ecosystem. So look forward to sharing learnings and be a part of this exciting platform.
Fantastic. Thank you for sharing, Vikram. So to the audience, our third panel speaker is Jonathan Siddhartha, CEO and founder of HaloDoc, which is like one of the top telehealth platforms in Southeast Asia, number one in Indonesia. He's still sort of having a little bit of technical difficulty, so we will kickstart it. And then for the first question, probably given the VC background, and as Vikram said, the consulting and all of the overseeing the startup scenes in Southeast Asia, you guys can share more about the startups for the first questions. So first question is, as we think about disruptions in Asia healthcare market in 2020s, we cannot talk without the impact of COVID. So how has it changed the speed of digital transformation and the speed of disruptions? Do you think it will be sustained after COVID times? I will start with Vikram.
Yeah, look, I think in many ways, COVID was a shot in the arm for digital transformation in this sector across multiple levels. If I look at when we kind of roll back to the early waves of the pandemic, most health systems in our part of the world, and frankly globally, were brought to their knees, where access to sites of care was almost physically cut off, right? No one wanted to be in a site of care unless they really needed to be there. We've all seen all of the horrific pictures of what's happened in many of our markets here. I think what that did was, for the first time, every large or small corporation had on their agenda digital transformation. That just moved up massively, right? And we triaged through Zoom or Teams or whatever else it was, to start to get care out to patients. And guess what? Systems realized that, wow, this actually works. The patient said, this is a good way for me to engage with a clinician when I need to. Not in every use case. There's a long-held belief that clinicians would be the ones who would not adopt technology as much. When we talk to specialists, irrespective of age group, they're telling us, well, this is actually great. I get a chance to spend, if I spend 10 minutes with a person on a consult, I get much more intimacy with them, and it's a much more fulfilling interaction relative to, the appointment was supposed to be at noon. They waited for 4.5 hours. I met them at 4:30. It was a 4-minute discussion. I was busy typing something in a computer at the same time. And digital health has allowed me to be able to engage with my patients and provide the care that I would have wanted to provide. And so I think it's restructured a lot of old and preconceived biases. And we see it from patients, we see it from clinicians, and then frankly, I think what we've seen is that the healthcare ecosystem has caught up, right? If you look at from a provider perspective, all providers now see almost healthcare has become O2O in our ways, right? Not online to offline like it was for retail, but offline to online. And so there is another waiting room. It's a virtual waiting room where you can engage with patients. From a patient perspective, the patient who was frustrated saying, look, I can order a taxi on this. I can order my food on this. Why is healthcare such a broken experience? Why can't I engage with healthcare systems? And then what we've seen is frankly, care systems are evolving, right? You see payers who've always, for the longest time, offered telehealth, suddenly saw an uptick of it. And they realized that it can play a massive role in unlocking a lot of the transformation we were looking at and hoping to achieve in this health system, right? Do you use telehealth to drive steerage? Do you use telehealth to drive triage? Why do we need to, let's debottleneck physical sites of care. So I think, in many ways, COVID has been a massive shot in the arm to accelerating the digital agenda of every player in the healthcare ecosystem. I don't think you can talk about healthcare without the term digital being in that same sentence in some ways. I'm excited for what this has done. I think we're also excited is, as we've seen across markets, the normal has been reset, right? So while you saw digital engagement massively rise during the start of the pandemic, as we've gotten to some version of controlled recovery or living with COVID, while levels of engagement with some of these digital platforms has come down a little bit, but it is settled at a level that's 2 to 3x higher than what it was before, and people's behaviors are changing quite a lot. So I think it's been quite. I think we will look back in a decade and see that this one of the positive thing that has come out of this pandemic is just the massive acceleration of access, frankly, and affordability of care that has come through this.
Yeah.
Amazing view. Joseph, do you want to jump in and then share a little bit more of the investing side and then the early startups that you see in Asia?
Yeah, happy to. Thank you. And that was a very comprehensive answer, and I don't have too much to add on top of that, except to say that with this increased push for digitization, we've had kind of a Cambrian explosion of a lot of digital health solutions that have come out here. I think a lot of the investment, especially in Asia, have really been geared towards things that have some sort of familiarity attached to a business model or platform that has worked for another sector. So is it like an Uber for doctor? Is it, a marketplace for, healthcare goods and consumables? Or, the telehealth platform is essentially a glorified Skype call, right? So, is it a B2C model? Is it a B2B model, B2B2C model, recurring revenue, SaaS kind of model? So it's been less about investing in new and pioneering technologies as opposed to ways and, channels, business models and all that. It's been, how many users do you have? Like, what's their trajectory? All these metrics that you see with other types of analogous platforms for other sectors, be it financial services or social networking or whatnot. I do think, however, there needs to be order brought to the chaos. There's been a tremendous amount of financing deployed in this sector in a very short time. And, at some point, the businesses need to catch up to their valuations and to their promises. And I suspect that's what we're going to see next. I think in the, first order investment categories, I think the ship has sailed if you're a new investor coming in here as an early stage. Pretty much every country has its foundational digital health platform, be it, and I do think it kind of follows the rule of two, where you have like your 90% market shares in one and, 10% market share in number two. Of course, there are going to be exceptions to this as markets are still settling out. And then, niche players taking kind of the rest of the pie amongst themselves. I do think, again, there will be a consolidation for these primary platforms. So for me, I love investing early. That's what we do with our fund as well. We like to be the first or second investors. So we look for now second and third order effects. So what do we need to invest in order to enable these platforms to win and stay winners?
That's very interesting. Thank you for sharing. We have our final panel speaker, Jonathan, joining. I'm not sure. I think camera is not working, but hopefully we can hear him. Jonathan, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, we can. Thank you so much for joining. So I did a brief introduction of yourself, but if you can share a little bit about you. And then our first question was about the COVID, how it has changed the entire digital transformation, and then will it be sustained? If you can answer shortly about that point of view, then that would be helpful.
Hi, Vikram. Hi, Joseph. My apology from my end for connecting late. So a little bit about Halodoc. We are a platform who connect patients with 20,000 doctors, 4,000 pharmacy, almost every single hospital in Indonesia, which basically during COVID, we have been working very closely with the government, maybe the only one in the world probably that try to solve COVID using telemedicine, a private-public partnership in which we provide the telemedicine services and medicine basically sent to the hand of the patient within 15 minutes to and the medicine is actually all fully covered by the government and including the delivery in that regards. So I think digital sector have plays its role when time is need. In this case, I think COVID is a great stress test for for digital healthcare, in which I think today, if you take a look at the matrix of healthcare in Indonesia today, I think we are as a country, we are very happy with regards to success of our vaccination. As platform like Halodoc, we are also being part of a massive thing on the distribution of vaccine, but we are also part of the service of creating care. So just maybe a bit of numbers for people to understand. 35% of positive patient are treated through telemedicine. And that 35 and all of which I think about 70% of them, the medicine are actually covered by the government. So that's just a bit of a brief on the main topics of how digital healthcare actually plays a role in the healthcare ecosystem itself, in Indonesia at least.
Thank you so much for sharing, Jonathan. So, given we have 15 minutes left, before we go to the next question, if it's okay with the panel speakers and also audiences, we will have like 5 to 7-ish more minutes. Given we had a little bit of technical difficulty at the upfront, so if it's fine, then we will end by 9:20 to 9:25. All right. So next question, given we talked a lot about the patients and how the COVID and digital transformation is affecting more affordable care and accessible care. The second question is more about the disruptions. Is it affecting overall patient behavior in general? So what are the biggest unmet needs for patients, and specifically in Asia, not in US or Europe, but in Asia? And how companies like either corporates or startups are addressing those pain? And what could be the new normal? We'll start with Jonathan this time then.
Okay. So I think the world pre-COVID and post-COVID, in my opinion, with regards to patient journey, will change. There are areas where things will. I think the simplest part is, if you take a look at Indonesia, people used to come to hospitals and flog it and wait until 4 to 5 hours. None of them would actually do an appointment services. In which today, if you take a look, like Halodoc itself, other than providing the telehealth service, we also provide appointment services. Today, we can consider people are feeling very comfortable with the situation of COVID, and that people actually comes to hospital more regularly. But what is very interesting for me is to take a look at the change of behavior on people actually doing not just telemedicine, that's still growing, but it's actually the way people are actually now making bookings of appointments, because people said, why should I come to hospital and wait around people who are sick if I can actually manage my time and meet them? So I think that is a small behavioral change that, in my opinion, has a big impact on how healthcare is being transformed. Other than that would be how people are so comfortable now with getting medicine delivered to them, because as I think a lot of us, in Indonesia, I think most of the pharmacy are mom and pops. It's not like the one in US where it's comfortable to shop around at like in CVS or Walgreens, but this is just like a corner office shop that buys medicine, and people are starting a lot to be more comfortable, especially for refill medicine, just to get delivery service. In my opinion, this will stay and will last. So the patient journey is definitely changes, especially when it comes to episodics or multiple episodics healthcare management or disease management, in which now the use of platform, especially in a country that is very supportive of digital healthcare, definitely will have a lasting impact on the way patient and provider manage a particular disease. I think that's my view of things.
Thanks for sharing. Very powerful. Jonathan, do you want to share next about your perspective on it? Oh, sorry, Joseph.
I think I need to kind of caveat that Asia is a big place. I mean, we have over 4 billion people. We have places where you have basically no doctors, no access to healthcare. Then you have places like, in Japan and Korea, where your doctors and beds per capita are much higher than we'd find in OECD countries. So I think we need to caveat with that. And we also need to caveat that we have a wide variety of different segments with different needs. And I think the one interesting thing about digital is it allows you to kind of tease out these nuances. It allows you to better serve particular subpopulations and segments in different way, and it also allows you to come up with tools to better service a health system that's being constructed in a path dependent way. This is a woefully generic statement that lacks tangibility, but this is what our common denominator, which we have to start with when we're talking about a territory as vast as Asia and as heterogeneous as Asia. What does this mean for care? If I were to take this all under one umbrella, is again, you have now the possibility to do a bit more experimentation. You have the possibility to see what works, see what doesn't in a much faster iteration cycle. And then you have the ability to also, trade across different geographies and segments, what works and what doesn't, and see if you can apply what you learn from one territory to another, or one segment or one disease area to another in a much faster way. Don't know. This is a very non-answer, so you can dig dig harder and dig to some tangibility from me.
All right. I think we have a Q&A session for that, so we can a little bit drive into detail for that session. Lastly, Vikram, do you want to share your view on it?
Sure. Very happy to. I think actually COVID has fundamentally transformed the patient journey across markets in Asia. And I think both Joseph's points and Jonathan resonate a lot. I think, again, there is no one Asia, and it varies quite a bit. So we spend a lot of time trying to understand this. We have a flagship report we publish every alternate year called The Front Line of Healthcare. And it was a global report, and always the front line of healthcare was seen as the healthcare practitioner. Our provocation was in India, in Asia, the front line is actually the patient. And so we went and interviewed 2,000 consumers and clinicians in 2019 about their health-seeking behavior, and we probably have the most untainted data set now pre-COVID, and we just did that a few months ago. And if you look at that, I think there's some really interesting learnings. First is health is absolutely on top of the agenda for consumers. I think all of us in many ways felt our national health systems, our insurers, and just the care systems let us down in many ways. And so people want to take a lot more control, right? What comes out right on top is I want more control over my health. By the way, I'm also willing to pay more for it now than I was before, because I realize that there is a need to this is important. And we'll talk about government in a second, but for governments, we feel healthcare is the new national defense. Now, I think how it manifests has been quite different in markets where you had massive access challenges, right? So you look at a market like Indonesia or China, or even India to some extent, digital health really stepped up during that time. And to the point that Jonathan made earlier also, right? Digital first triage. Frankly, I think there's a lot of lessons learned, that Singapore, Hong Kong, and others have learned or learning from what happened in Indonesia in how the digital health ecosystem stepped up to manage this pandemic. And so what the derivative of that, right, is that the patient journey now is becoming a more virtual first in these markets, where the next best option was to go to a public hospital and wait in line. And so now I use digital health to triage. I use that to make appointment bookings, and then really use the healthcare system where I need to. So in many ways, it is bringing care closer to the patient. No patient wants to be in the hospital unless they really need to be, right? And that is actually the right answer for the system too. Now, what you've seen in markets like Singapore, Hong Kong, where you've got a very well-developed outpatient ecosystem. And so there is I can walk 5 minutes outside my apartment here and find at least 5 GPs, right? So that journey now has shifted and become much more omni-channel. But I will use it where I want to. I think what it's also done is moved care outside the hospital to outpatient sites of care, to ambulatory surgery centers. And so people are looking to minimize, hospital, how much time they spend in hospitals. I will only go to the hospital if I need to. And in many ways, if we look at what will transform care for Asia Pac over the next decade, it has to be, we can't make the same mistakes many other markets made with being hospital dependent, right? Hospitals will always play an important role going forward, but for certain, when I really, really need them. So in some ways, it's helped kind of change the patient journey. the patient's taking a lot more control of it. Care will be delivered closer to the patient. Care will be delivered in outpatient sites of care. A lot more on home care as well, right? It's been interesting to see that there are companies like Homage and others. Jillian's doing some really interesting work around bringing care closer for seniors, and in many ways, I think it's an exciting, supporting time for transforming care in this part of the world, which I think will provide lots of lessons for other parts of the world.
Thanks for sharing. It's interesting to see that in Asia, actually, the virtual care can be even like before transforming the entire care delivery model. So, which is quite interesting to hear. So, our last question is about the government sector. Actually, interestingly, one of our participants asked the exactly same question that I was about to ask. So it will be automatically answered. So last one is about the most important stakeholder in healthcare system, which is government. So what are the disruptions happening in like government regulation and policy side, like in terms of the investment or some support? That there can be either government-driven digital transformation or more company-driven transformation, but with the government support and like ease of the regulations. So what kind of the trends do you see in Asia? But more specifically, if you want to discuss a certain country, then also very welcome. This one we will start with Joseph.
All right. I'm surprised you didn't ask Jonathan first, given he's very, very deep in Indonesian. I'd say he's one of the success stories in actually working with government here, but I'll give it a first shot. So I think first and foremost, the government out of necessity had to relax the regulations on things that they were hesitant to do earlier. Even things as basic as providing a medical certificate, like if you have to stay home from work over digital, to, the delivery of actual pharmaceutical compounds that are not necessarily over the counter, but actually prescription. That was a big jump for a lot of people. But I think the one place where really has yet to reform as much as I'd like is really the interface with public records, and also around the actual way that public records are kept. A lot of countries have roadmaps, and I don't want to pick on any unfairly, of how to do a national health record, or what's your digital health storage strategy for the whole country. And a lot of them have stayed in the planning phase for a lot longer than they probably should have. And then secondly, even if they do exist, you don't have a capability for third parties to contribute or access this data with ease. It still retains in the hands of public sector, which is not involved in the provision of digital health too much. I'd say that there's one country in Asia that or maybe renegade province, depending on which political line you stand on, that's done a very good job here, which is Taiwan, where they actually do have a national health record. They have a national claims database, kind of a one source of truth. And they also have an API by which digital health providers can interface with this data, of course, if patients give consent. And I think this is a really nice role model for other countries in Asia to adopt similar models and how to make this work. I think the role of government is not to overregulate, but to ensure that things are safe and responsible, but also to define the architecture and the scaffolding by which all of this shall hang off of. And I think that's the most important role for government. And the thing is, depending on the attitude of the government, are you privacy oriented, or are you common benefit of the common good oriented, will necessarily shape how these rules and policies appear. You could be like Germany, where you're privacy obsessed for good reason, or you could be like China, where it's the people's data, right?
Very interesting. As Joseph first opened the discussion with mentioning about Indonesia and Jonathan, I would love to listen to your opinion about your relationship, Halodoc's relationship with the Indonesian government, and what are your views on it?
Thank you. Joseph, I think, opened it very nicely about his view of things, of how government should being supportive rather than overly regulating. I don't understand enough about Asia. I understand a lot about Indonesia, and I can speak about examples of how we work with the government, if you don't mind. So I think that the two big parts of how the government of Indonesia is using COVID as a catalyst. Number one, I think the two big theme. Number one, they show support to players like HelloDoc by actually incorporating us on the way they manage the country. So, for example, Indonesia has a new application for the whole nation called Peduli Lindungi, which is an application that allows you to go to malls or allows you to travel or whatnot if you have done your vaccination, if you have done your COVID tests, and so on. Now, that application is connected closely with application like HelloDoc. So so they don't try to compete with us. They actually support us. So you do the bookings using HelloDoc, you do the PCR tests and other using HelloDoc. But the results, not just it comes out in HelloDoc, it comes out in this Peduli Lindungi apps, which you can use it for malls and everything. They speak with us very closely on the interface and everything. So you can see that they basically embrace players like us as part of the solution rather than just overly regulate. So that's I think number one. So this applies with vaccines, applies with medicine, applies with telemedicine, in that application they embed us and also a few others as an application that is not sponsored, but it's approved by the government, put it that way, right? But other than that, so the first theme is the government support by embracing us. The second big part is government reformation. So the Ministry of Health is actually create what they call the Digital Transformation Office, in which they now create a roadmap of changes of digital healthcare in Indonesia, and in which it comes in English in Indonesia as well. So people all around the world, you can actually read what is coming in Indonesia in the next 4 to 5 years. It's very clear about the execution and the timeline related to parts of application, personal medical records, regulation, what are the application that the government built to support the nation. And it's very clear that they are encouraging players like HelloDoc to actually build, and they will support. So they do not want to compete with players like startup of healthcare or what do you call it, corporation that want to build. They just want to enable us to actually perform. I think that's what I can share about how Indonesian government reacts to digital healthcare today.
That's fascinating to listen of the public-private kind of the supporting each other care delivery model, and look forward to the future in the Indonesia healthcare system. Then, lastly, Vikram, do you want to share your views on the government and regulations?
Sure. So very happy to dive. I think both Joseph and Jonathan talked a lot about how digital and the public sector has embraced digital in varying shapes and forms. I think the few things we've seen more broadly, right, is that I think coming out of this pandemic, healthcare is on top of the agenda for most governments, right? We call it almost healthcare is the new national defense in many ways. As frankly, in many cases, healthcare systems failed their citizens during this crisis, and so we see health much higher on the agenda. I think every market in Asia, in some way, shape, or form, now has got some version of universal healthcare. I think what the government's also recognizing is that their job will be to provide the social safety net, at least at a bare minimum. And how do you co-work with the private sector to really play an important role in changing healthcare? I think digital is also very, very. It was. I love Jonathan's term on COVID being a stress test. In many ways, it was a stress test for the overall healthcare system. And I think what people saw was during this time, virtual care and digital really helped step things up. Also exposed a lot of vulnerabilities in the legacy offline way of doing things. And so, I think governments are much, much more supportive. The conversation we're having now and the examples both Jonathan and Joseph laid out, you could not imagine having this discussion 5 years ago or even 3 years ago, right? And to see the mindset shift, there's a lot of support here. I think, and governments are much more willing to experiment, right? There was, for the longest time, the framework around reimbursement and telehealth, etc., was just stuck. And in weeks, what took years to happen happened, and now we're seeing that the growing trajectory behind it.
Thank you. Thank you for all of the fascinating discussion. And I think we have around 5 minutes left, and I would love to open to our Q&A session. We have two very interesting questions here from Cindy. So with excessive investment during COVID from government, public sector, will healthcare stay in strong growth path in the next few years? And in which track will it accelerate, given there might be limited resources? I would start with Jonathan, since you've gotten some support from the government, and then you are also experiencing some limited resources, I presume. So how do you see the future of the growth?
I think the future of growth would be positive, in my opinion. People are one key area of growth would be on preventive healthcare, because I think a lot of people will be so tired of curative. The fact that now curative digital platform is helping. I think the biggest change, in my opinion, of behavior is people are care more about their healthcare. I think all of us in every dinner table or lunch table, we will pretend that we know everything about healthcare now. So I think a lot of us have changed into this mindset. So to answer in short, in my opinion, growth area will be on preventive.
My follow-up question would be, what about the limited resources? What's your personal plan with the HelloDoc? How do you plan to resolve those conflicts and issues in terms of the resources?
I think resources with regards to doctors, for example, we only have 3 doctors out of 10,000 population in the country of Indonesia, compared to Singapore at 30 out of 10,000 population. So I think that parts will be a part that will be a slow burn to improve. But the fact, telemedicine company like us is providing a lot more efficiency and effectiveness, that plays a different role. Just to give you a bit of highlights, each doctors easily can manage 150 patients a day using their phone. Normally it's not happening in their physical world. So what I'm trying to say here is that one of the big roles of telemedicine here is actually providing that extra space of capacity because of efficiency that we brings out of necessities that a country like Indonesia, by default, we don't have that resource that is available in developed countries. And so far until today, touch the wood, we never had any resource issue. Again, we are the largest platform. We have 20,000 doctors connecting to HelloDoc. So every single hours, I think we are never out of out of stock or out of resource in that regards.
Understood. Thank you. Joseph, do you want to jump in and share what's your view on it?
Yeah, I have to agree with Jonathan. The idea that we have no choice but to shift earlier in the care continuum. I think with greater education awareness tools around us, I think what we'll be able to really do. Actually, maybe I won't try to predict, but I'll say what I want instead. I would really like it if healthcare was pervasive and transparent, and it was a critical component of everything that we do in life. We've been focused on sick care for the past, as far as we've known our health system in their current form, and we have this unique opportunity by which we can change the paradigm to make it a core consideration for everything. I don't know how many people during COVID lockdowns became professional chefs, but the concept of health being part of each activity and each thing that we do is something I'd really like to see, and what we're certainly investing towards. We are investing towards a future of ubiquity in this aspect, and we certainly have more than enough challenges. I think Jonathan highlighted quite a few of them. I think the other thing we need to talk about is the fact that everyone's getting old. And people in Asia have gotten old before they've gotten rich. And this is a really, really big problem, an enormous problem, the scale of which we haven't fully appreciated yet. To take Indonesia as an example, we will have more senior citizens in Indonesia by 2040 than we will in Japan. What's that going to do with the current GDP per capita and investment in healthcare, and as well as the geographic disparities of Indonesia with its 17,000 islands? what are we going to do? How are we going to change the system? And this is where we need to invest. And this is where we need to invest, in order to make sure that we have, a functional society after all this.
Thank you. I think it ties back to the second question: what are the unmet needs and what kind of the differences we see in our patient journey in Asia? And then what you just mentioned about we have to make it happen given the aging society, and also the affordability they can only take is limited. So given that this is the new move that we have to take in. Fantastic. I think we only have time to address last question, which is from David. How transferable are digital healthcare business models in America to Southeast Asia, or does US overspending on healthcare distort how useful the model is outside US? I want to start with Vikram, since you worked in New York office and Chicago office for all years. So I would love to listen to your views.
Yeah, look, look, it's a great question. I think that I almost think of it the other way around. Right, where there were, a lot of people will, and I think Joseph, you started with people, lose the analogy of the Uber for doctors, or I'm the Livongo for Asia Pac. I think what's important for people to recognize is the U.S. healthcare system structure is so different, right? And frankly, you look at the big pharmacy benefit management businesses, you look at the role employers play in funding care and the large insurance companies, and you create this big enough B2B ecosystem. That and the massive amount of funding that supports all of this. I think to me, what's exciting is what we are seeing in Asia is because we are resource constrained, we have found ways to deliver care in a much more affordable way, right? If you put in context, on average, I think healthcare spend per cap in Philippines is sub $200, right? In Hong Kong, Singapore, it's in the $3,000 range, and in the US, it's $8,000-9,000, right? So we are finding ways to deliver care in a much more efficient way. We're also finding ways to be able to leapfrog some of the inefficiencies that were built in the system, right? So we don't have PBMs in some ways in these markets, but you are seeing a digital version of them emerge in some ways, right? You are seeing also in our markets a move towards taking out leakages or excessive, distributor margins in pharmacy, for example, lab margins, right? And saying, how do I provide care in a more efficient way with more volume, albeit with lower reimbursement, but people are creating a lot of sustainability. So to me, I think it's, I would answer this as there's a lot of learnings of what we're seeing in this part of the world, and not just Southeast Asia, but I think in China, in India, that can really be transferable. And where I'm spending my time, actually, I spend more time with our clients in North America today, talking about what they can learn from this part of the world. And that's where the excitement is, on people saying, look, let's reimagine healthcare, but let's learn from what's happening in a market that's resource constrained.
Amazing. I would love to continue the discussion, but unfortunately we're already 9:25 here. Probably in Singapore, the 8:25. So I think we have to close our session. Thank you so much for joining us, Vikram, Jonathan, Joseph, and audiences. It was fantastic discussion. And we hope to see the new disruptions in Asia in near future. Thank you for joining. Bye.
Thank you so much.
Thanks for having us. Bye-bye.
Everyone.
Thanks, Joseph. Thanks, Vikram.
Thanks, Jonathan.
Thanks, Vikram.
Well,
Thanks, Diane.
Thank
Cheers.
you.
Sorry for my camera. I don't know why it's not working.
no worries.